If you understand some of the basics about how the cells of the human body work, you know that the cell is built up with a wall around it. That's an individual cell. For hormones that circulate around the bloodstream to affect a cell, they have to go through the cell wall. The only way to do that is to be bound to a receptor, initiate a change at the cell surface, and then after the change, the message from the outside of the cell gets transmitted to the inside of the cell, specifically the nucleus, where DNA either turns on or turns off some kind of reaction. And then you have, hopefully, a healthy cell, and its functions are maximized. If it happens to be a brain cell, hopefully the brain cell fires off and functions like it's supposed to. If it happens to be a white blood cell, macrophage, a B cell, or a natural killer cell, those are the guys that go around and hunt for infection, for viruses, for cancer, then those guys will get stimulated to do what they have to do best. Take the opposite of what happens if you get exposed to a carcinogen, like tobacco, for example. When tobacco floats around in the bloodstream, it attaches to the surface of most cells, causes a message to be transmitted to the nucleus of the cell, and the cell starts to morph into a cancer cell. The cells of the human body appear to have endocannabinoid receptors, and there is something called an endocannabinoid system. There are a lot of cells that have the receptors for the endocannabinoids, specifically the brain cells, which have CB1 receptors, the macrophages, natural killer cells, B lymphocytes that have the CB2 receptors. So far, science has demonstrated at least those basic concepts. In fact, the science is good regarding the effects of CBD and THC on cachexia, which is wasting away of the body due to poor nutrition, nausea and vomiting like in chemotherapy treatment or HIV treatment. In fact, there are medicines, one of them being dronabinol, or also known as Marinol, that are being produced outside the US specifically for the symptoms of nausea, vomiting, and muscle wasting. You'll hear about anecdotes throughout the internet where the CBD component, if it's high enough, can turn off epilepsy or seizures. Getting back to the science of it, we know that if you smoke the plant, mostly the flowers and the leaves, it will produce an effect. The effect is either psychoactive with regards to the THC component, or supposedly anti-inflammatory with regards to the CBD component. Medical marijuana has many different active ingredients, but those two are the most studied. If you're one of my patients and we're embarking on the use of medical marijuana for your disease process, just know that you don't have to smoke it. There is also vaping, which usually produces less carbon monoxide than smoking. And there's also oil, topical and oral, that can be used either in your edible products or to apply onto the skin. With my fibromyalgia sufferers who are hitting the wall and looking for a way out of suffering, it would probably be wise to start low and then work up. As you know, if you suffer from fibromyalgia, you will be more sensitive to many different things compared to the average person. So whether you start with a topical, an edible, a vape, or a smoke, I think it would be wise to build up. So getting back to what's outside the US, I already talked about dronabinol. There's also a newer drug in Europe that's been used to block the receptor that's found on the cells. In particular, that receptor has been known to stop the reward you get or the feeling you get from eating. The application has been for medical weight loss. And going back to the information from Donald Abrams, we know that if you stimulate that same receptor, it'll make you go for the munchies or increase hunger. Might not increase weight, but the studies show it increases hunger. That's what the science is out of Europe in blocking that same receptor so you don't eat at all. I like to consider medical marijuana, whether THC dominant or CBD dominant, to be a vehicle to get you to a better lifestyle and decrease suffering. With regards to the THC component, you will have more effects in the brain and the psychoactive high that some people go for. It is therapeutic as far as those that suffer from post-traumatic stress disorder, like our vets from foreign wars, in being able to function in society again, or with a lesser intensity to treat problems with insomnia or anxiety. The CBD component, I think, is really exciting because it can be used for inflammation control. And I'm having my patients consider using the topical form for localized discomfort like in arthritis, or trigger point relief in fibromyalgia sufferers. If you click on the link to my medical marijuana talk number 1, you'll see one of the local dispensary representatives and his personal story with the use of medical marijuana in Crohn's disease. CBD can be formulated in the form of medical marijuana, and for which you have to have one of 40 diseases according to the Illinois Department of Public Health. Or you can get it over the counter when the CBD is derived from hemp. The jury is still out with the CBD that comes from hemp. Usually comes in oil or liquid, but it can be found either online. Locally, I have a pharmacy called Wholesome Health Pharmacy that actually supplies it as well. They stock it now, and we're seeing if it helps. Since they do carry the CBD oil, it's more reassuring when a pharmacy carries it. We'll see how the application process provides my patients for a decrease in the inflammation. Quality control is always going to be a concern, but the downside is very low. In theory, it should work just as well as the medical marijuana CBD. But remember, this should be another band-aid in taking care of you trying to get to a healthy lifestyle. I would always use it to help accelerate and improve your level of functioning, but eventually I would always look for weaning off or tapering off. With CBD from hemp versus CBD from medical marijuana, sometimes when science tries to isolate the active ingredient, you lose some of the properties or benefits of the whole plant. When you smoke the whole plant, depending on where it's more THC dominant or CBD dominant, both of those active ingredients work better when they're together. But because of the laws of the Fed, in addition to state laws, the current position is to try to isolate that one part, the CBD part, because of its supposed anti-inflammatory effects without having the THC part. And hemp has long been used as a very fastidious plant that actually mirrors cotton in its function for the textile industry.